Let's continue with the fourth family called microtubules inhibitors. We already know there are 8 families. Now we are talking about the fourth family called inhibitors of microtubules. Before I mention them, firstly you must be aware of the meaning of microtubules, which are explained in the past video. I devoted so much time to explaining cell cycle, and I told you during cell cycle at certain stage called prophase or metaphase, then telophase. At these stages, cell forms something called centrosome at the 2 poles of the cell, extending some filaments called mitotic spindles in order to separate the 2 sets of chromosomes apart from each other, 46 here and 46 there. These mitotic spindles in all of the living cells. To the best of my knowledge, all the living cells, including plant cells, all of these cells form these mitotic spindles at some point of cell division. Now we have a family of drugs called microtubules inhibitors. All that they can do is to inhibit these microtubules or mitotic spindles. They either inhibit their formation, thus cells can't form mitotic spindles and can no longer divide, that's possible, or cells can form mitotic spindles but they are not functioning and can't attach to chromosomes, they can't pull them apart. So mitotic spindles lose their function. They can't separate the 2 sets of chromosomes apart from each other. So in order to avoid any confusion, we just call all of these drugs microtubules inhibitors. Don't bother with details. They just inhibit microtubules during metaphase. Accordingly, they prevent cell division. This mechanism can work in animal cells, plant cells, or cancer cells, depending on what cell type you choose. Before we get into details, I want to clarify something important. When I tell you there is a drug that works by inhibition of microtubules, may I ask you whether this drug can target any cell at any stage of cell cycle, or it can only work at a certain stage? Think about it. If someone asks you, are these drugs considered cell cycle specific or non-cell cycle specific? The answer is, all of this family called microtubules inhibitors, since they attach to mitotic spindles, then they are classified as cell cycle specific because they don't work except in this stage, the stage of microtubules formation. If I apply these drugs to any cells which are not forming microtubules, they are resting cells, so the drug can never target them or interact with their DNA. The drug has nothing to do with such cells. It doesn't work except in this stage only, thus it is called cell cycle specific. In general, what are these microtubules inhibitors? We have this drug and another one on the next slide. We have 2 important drugs from a family called vinca alkaloids. They are vincristine and vinblastine, 2 twin drugs extracted from this beautiful flower in this photo. This flower you see, or this plant, that's called vinca plant. Naturally, it has a long Latin name, but we have nothing to do with it. This plant or this flower is not an ordinary flower you see in streets. This flower is so special that it only grows in Madagascar Island. If you wish, open your map and see where is this Madagascar Island. This flower only grows in there. And this beautiful flower gave us this family called vinca alkaloids, which are vincristine and vinblastine, the 2 twin drugs. However, there is a small difference between them. I'll tell you about it later. We already discussed their mechanism of action and I told you they are cell cycle specific. Now the adverse effects. There are general effects, we won't talk about it, they occur with all drugs, bone marrow suppression and so on. So let's see these specific side effects that differentiate between these 2 drugs. This is vincristine and this is vinblastine. Both drugs cause bone marrow suppression and peripheral neuropathy. However, both vincristine and vinblastine, regarding their bone marrow suppression, vincristine only takes 1+ mark as you can see, which means that it causes little bone marrow suppression, as if it is sparing the bone marrow, hence it's called bone marrow sparing. On the other hand, this vincristine is the master of nerve damage. People on vincristine experience peripheral neuropathy, autonomic neuropathy, and other nerve problems. So this is a question concept. When someone asks you to differentiate between vincristine and vinblastine, tell him vincristine is causing mild bone marrow suppression, but it's famed for this peripheral neuropathy. On the contrary, vinblastine is causing severe bone marrow suppression with very little or no peripheral neuropathy. This is the only difference between the two drugs, despite they both come from the same plant. To make it even easier for you to memorize, remember that vincristine has C. Since it has C, then it has something to do with CNS. Then this vinblastine has B in it, so it is the one causing bone marrow suppression. B is for bone marrow suppression and C is for CNS effect. After this remember we are still discussing microtubules inhibitors. The second drug in this family, remember that we choose two well-known drugs from each family. Second drug we have is from a family called taxanes, and it is called Paclitaxel. Taxanes is the class of the family and Paclitaxel is the drug. This Paclitaxel, I don't know how to say this, but consider it to be one stroke of luck, a happy coincidence. I'll tell you a story, a quick one you will never forget, so you can always remember this drug. This tree you see, this tree grows in some islands in the Pacific Ocean. People who discover new drugs and research for new ones every day, sometimes they say, why do we waste our time on studying and on new unpredictable experiments? Such approaches waste so much time and money. Instead, we can go to isolated areas of the world, distant islands with isolated population. Look how these people think. They say, let's study those clans living in the edges of Northern America and mountains isolated from civilization, or clans living in islands in the Pacific Ocean or in the middle of Africa. Let's see how these people treat their diseases. Surely they have some drug formulas that's working just fine for them for hundreds of years. Instead of searching for new drugs, we can study these formulas. One of the happy coincidences is when an American research team went to study the folklore of some clans living in northwest of America, in some mountains. These people didn't know of doctors or anything similar. These people were treating their diseases using the bark of this tree. By the way, this tree is called Texas tree. They took this bark, broke it, and boiled it in water. Then they drank it for treating malaria. They were living like this. But did this work? Did this treat malaria? Yes, it did. American research team took this bark and studied it in their research labs. They found out that it contains family of drugs they later named taxanes family. And when they tried it on malaria, this drug proved to be effective. With further research, they found out this drug attaches to mitotic spindles, preventing polymerization and cell division. Thus, malaria protozoa can't divide. Then they tried this drug on cancer cells by the same mechanism as the previous Vinca family. And since both drugs works by the same mechanism, then they should be equally effective. When they tried this drug on cancer, they found out that it also attaches to mitotic spindles of cancer cells, preventing cell division. And this is great. Do you know that this drug taken from this tree, once they released it to markets after clinical trials, one vial of it costed about $3,000. It was one of the most successful drugs in treating breast cancer and ovarian cancer when they tried it. And when they tested this drug on cultured cells in vitro, they found it to be one of the most effective drugs in cancer treatment, and it was very expensive. This drug called Paclitaxel. This Paclitaxel is similar to the previous family called vinca alkaloids regarding the mechanism of action. Both of them attaches to microtubules and both of them are cycle specific, and its specific adverse effect is also peripheral neuropathy. Now let's shift to the fifth family called hormones and their antagonists. Now we are about to finish as we don't have much left. Where did the idea behind hormone antagonist come from? Simply enough, when scientists found out that some tumors such as breast cancer or prostate cancer, look, when we were students, they were used to tell us these tumors are living on hormones in the body. So cancer cells in women with cancer breast are drinking estrogen. These cells are living on estrogen. Cancer cells in men with prostate cancer, these cells are living on testosterone. If you deprive them from testosterone, then they can't live anymore. This is what they eat and drink. Thus, these tumors are termed hormone-dependent tumors. You will encounter this term in pathology books so many times. This is how the logical idea behind these drugs came to life. Since you know that a tumor is living on a hormone, then let's design a drug called anti-hormone or hormone antagonist. We have 2 slides about these drugs. On the slide, I'll tell you about a type of drugs called anti-estrogen or estrogen antagonist. Since you say estrogen antagonists, which mean drugs fighting this hormone, tell me who can benefit from these drugs? Of course, women with breast cancer. On the next slide, we have anti-testosterone. Who can benefit more from these drugs? Men with prostate cancer. Generally, what are these anti-estrogens? We have 2 very well-known drugs. We have a drug called Tamoxifen and we have a family called Aromatase inhibitors. We are going to explain the main points, but we won't dwell into details because we didn't discuss gonadal hormones yet. We didn't explain estrogens and others. However, we are going to explain them all in detail when we discuss female hormones and gonadal hormones. But for now, I'll only discuss what we need to know about cancer. This is Tamoxifen. It is the first drug discovered or released as anti-estrogen. When they tried this drug, they found out it wasn't a pure antagonist. This drug is somehow confusing. This Tamoxifen and it has a brother called Ramoxifen. Why is this family confusing? It's because when they reach breast tissue, they block estrogen receptors in the breast. On the other hand, when they reach uterine tissue, they stimulate estrogen receptors in the uterus. And when they reach the bone, they also stimulate estrogen receptors there. They act as blockers in some areas and act as agonists in other areas. So we cannot classify them as agonists nor as blockers. Hence we're termed mixed agonists and antagonists. But after some time, they decided to promote them and give them a better name so they can advertise and sell them for higher prices. That's why they are called estrogen receptors modulators, or sometimes they are called selective estrogen receptors modulators. So they can avoid calling them blockers or agonists. They are just modulators. They are blockers in some areas and stimulators in others. Now I'm only interested in the areas where they act as blockers because I want a drug that blocks estrogen receptors. This drug is a blocker in the breast. This is only what we need to know about it. Consequently, women with breast cancer go to surgeons to remove tumors, and for 5 years period they receive this Tamoxifen. 1 tablet per day, 10 milligrams. Why? Because it blocks estrogen receptors in breast. Since breast cancer cells are living on estrogen, And in case of scattering of some cancerous cells here or there, then we give this tamoxifen in order to block the receptors, depriving these cells from consuming estrogen. At the same time, I am not worried about bone, as this drug stimulates the receptors in the bone, so I am not worried about osteoporosis in women. If you give some women pure estrogen blockers, they are expected to experience osteoporosis. Now we are not worried about this problem because this drug blocks receptors in breast while receptors in bone are working just fine. That's why women with breast cancer after removing this cancer receive this tamoxifen for 5 years period. Now the only problem is its thrombotic complications. This is a famous MCQ question. Examiners always ask you about the most common side effect of this drug. Tell them, women receiving this tamoxifen for 5 years period, many of them experience something called deep vein thrombosis, thrombosis in the legs. This drug is well known for this side effect. This is all what you need to know about tamoxifen. Now what about aromatase inhibitors? This is a new expensive family of drugs. It was discovered that old women after menopause, postmenopausal women, many women at the age of 50 years, 60 years, or 70 years have breast cancer. It's not enough to remove these tumors. Why? Because they must receive anti-estrogen. But why? They already don't have estrogen. She is 70 years old. Her ovary is now atrophied. It is no longer releasing estrogen. Why would I give her anti-estrogen? Now you are wrong about this. You didn't study enough. Because all of us, either men or women, we both have aromatase enzyme. Don't you ever forget about it. This aromatase enzyme can convert so many compounds called steroid compounds present in our fat. This fat contains so many steroidal compounds. This aromatase enzyme can somehow convert these compounds into estrogen. This is strange. So 70 years old women still have estrogen? Yes, they have. Where is it coming from? Of course, not from the ovary, as it is now atrophied. However, it's coming from this aromatase enzyme. It takes some compounds from the fat and converts them into estrogen. Now we can't give this patient tamoxifen. It won't work. It is better for postmenopausal women with breast cancer to remove the tumor than receive a drug called aromatase inhibitor. This drug inhibits aromatase enzyme, so I can ensure that any adipose tissue in her body won't form estrogen at any day. What is the most common aromatase inhibitor? The drug called letrozole, or by a trade name of Femara. Oncologists prescribe it to these women. In order to make this story easier for you, always keep in mind that 1 + 1 = 2. A woman with breast cancer, number 1, before anything, we perform a surgery. Number 2, look at her age. If this woman is premenopausal before the age of 40 years, she will receive tamoxifen for 5 years period after the surgery. If this woman is 60 or 70 years old, postmenopausal, she should receive this letrozole for 5 years after the surgery. 1 tablet per day for 5 years. Look carefully at the question. See how the scenario is going. Be aware of the examiner's intent. This woman with breast cancer, look at her age. He will distract you with details like previous surgeries or whatever. Look at her age. If this woman is premenopausal, before the age of 40, then she should receive tamoxifen after surgery to block estrogen receptors. If this woman is above 50 years, postmenopausal, she should receive letrozole for 5 years in order to prevent aromatase from forming estrogen in her body. This is the first family of hormone antagonists. Second family is antiandrogens. Now we are talking about men. We talked about antiestrogens, so it is only fair that we talk about antiandrogens. Let's assume a man has a prostate cancer. This prostate cancer is living on testosterone. It's drinking testosterone. So scientists invented a drug called flutamide. This flutamide blocks testosterone receptors, preventing cancer cells from drinking this testosterone. So this flutamide is a potent blocker for testosterone receptors. That's it. Only remember the name of the drug, and this drug is for cancer prostate. We only need these two words. If you hear about cancer prostate, remember flutamide. There is yet another drug you will hear about in many parts in pharmacology. This drug is called cyproterone acetate. It's also a testosterone blocker. However, it's far less potent than this drug. This cyproterone acetate also blocks testosterone receptors, but it can't be used in cancer. It's very weak. Indeed, it blocks testosterone receptor, but due to its weak effect, all I can use this drug for is something like hirsutism. A woman may come to your clinic complaining of hirsutism, hair growing on her face, or hair growing on her chin. Why do hair grow on her face or on her chin? It's because she have slightly high level of testosterone. Give her this cyproterone acetate. It's a weak drug and her body can withstand it, but don't give her this one because it's a potent blocker. It's used for cancer prostate, unlike cyproterone acetate.